Tinnitus in veterans, the role of cognitive behavioral therapy and management. Veterans commonly have questions about what to expect from CBT for tinnitus and how to access care. The following addresses the most frequent concerns expressed by those considering this treatment approach. How long does it take to see results from CBT for tinnitus? Most veterans begin noticing improvements within 3 to 4 weeks of starting CBT, though the timeline varies based on individual factors and consistent practice of techniques. Initial changes typically involve reduced emotional reactivity to tinnitus rather than changes in the sound itself. Many report that tinnitus becomes less intrusive during activities and that they recover more quickly from flare-ups. Full benefits generally develop over the complete treatment course, typically 6 to 8 sessions, with continued improvement often occurring for months afterward as skills become more automatic with regular practice. Can CBT completely eliminate my tinnitus? CBT does not claim to eliminate tinnitus. Sounds completely. Instead, it focuses on reducing the distress associated with tinnitus and its impact on functioning and quality of life. This distinction is important. The goal isn't silence, but rather changing your relationship with the sound so it causes less suffering and interference. Many veterans report that after successful CBT, they experience extended periods where they're unaware of their tinnitus, despite its continued presence. For additional support, some veterans explore options like tinnitus masking hearing aids to manage their symptoms. This approach acknowledges current medical limitations while offering realistic hope for significant improvement. Rather than pursuing the potentially frustrating goal of eliminating an often persistent condition, CBT provides practical strategies for living well despite tinnitus. Veterans who adjust expectations accordingly typically experience greater satisfaction with treatment outcomes. Do I need to see a psychologist, or can an audiologist provide CBT? CBT for tinnitus is increasingly delivered through interdisciplinary approaches involving both mental health professionals and audiologists. In the VA system, some audiologists receive specialized training in CBT principles for tinnitus management and may provide basic components of the approach. However, complex cases, particularly those involving significant psychological comorbidities like depression, anxiety disorders, or PTSD, typically benefit from involvement of psychologists with expertise in CBT. The Progressive Tinnitus Management (PTM) protocol, used throughout the VA system, employs a stepped care model, where audiologists provide initial management, with referral to specialized mental health providers for those requiring more intensive intervention. Will the VA cover all costs for CBT tinnitus treatment? The VA fully covers CBT for tinnitus for eligible veterans, with no copayments required for those with qualifying service-connected conditions. Veterans already enrolled in VA healthcare can access these services through appropriate referrals, without additional registration processes. If tinnitus developed during or was aggravated by military service, you may qualify for disability compensation in addition to treatment services. The current VA disability rating for tinnitus is 10%. Which acknowledges the significant impact this condition can have on daily functioning. VA Tinnitus Resources Resource Description: How to access progressive tinnitus management, PTM. Comprehensive stepped care approach combining audiological and psychological interventions. Request referral through primary care provider or directly from Audiology Self-Help Workbook. How to manage your tinnitus. Free downloadable workbook based on CBT principles, available at VA NCRAR website, https://www.crar.research.va. Gov, Shai Education, Documents, Tinnitus. Documents. How to manage your tinnitus. PDF VA Video Connect, telehealth option for accessing CBT for tinnitus remotely. Discuss with provider, requires smartphone, tablet, or computer with internet. Veteran-specific CBT for tinnitus, VET CBTT. Specialized protocol adapted for military experiences. Available at select VA facilities. Request information from Audiology. For veterans not currently enrolled in VA healthcare, the enrollment process begins by completing VA Form 10-10EZ, which can be submitted online, by mail, or in person at your local VA facility. Veterans with documented service-connected tinnitus receive priority access to audiological and mental health services. If you're unsure about your eligibility status, VA benefits coordinators can provide personalized guidance based on your service history and current needs. Even veterans who seek primary care outside the VA system can access specialized tinnitus services through the Veterans Choice Program when appropriate services aren't available locally or wait times exceed standards. This program allows eligible veterans to receive care from community providers while the VA covers costs. Discuss this option with your VA primary care provider if specialized tinnitus services aren't readily available at your local facility. Beyond direct treatment, the VA offers comprehensive support for tinnitus management, including assistive devices like hearing aids, sound generators, and combination instruments. These devices are typically available at no cost to eligible veterans when prescribed by VA audiologists as part of a comprehensive management plan. What if CBT doesn't work for my tinnitus? Remember that tinnitus management typically involves ongoing adjustments rather than a single cure. CBT, along with our recommended natural supplement source, are an amazing pair. Many veterans develop personalized approaches combining elements from various treatments that evolve over time as circumstances change. The goal remains consistent, developing effective strategies to live well despite tinnitus, even if the sound itself persists, with the comprehensive resources available through the VA system. Most veterans can find an approach that significantly improves their relationship with tinnitus and enhances overall quality of life. For more insights, explore progressive tinnitus management methods. If you're struggling with tinnitus and seeking expert guidance on management strategies, including CBT, connect with the VA's specialized tinnitus services today. Your path to relief begins with a simple conversation with your primary care provider about how tinnitus affects your life and your interest in evidence-based management approaches. Tinnitus is a common condition among veterans, often resulting from exposure to loud noises during service. One effective treatment option is cognitive behavioral therapy, CBT, which helps patients manage the emotional and psychological impact of tinnitus. CBT provides veterans with strategies to cope with the persistent ringing in their ears, improving their overall quality of life.